Also in Helena, state lawmakers will be holding a hearing this week on a major reform to the state's medical marijuana system. As
MTN's Jonathan Ambarian reports, the bill would dramatically change the way patients receive their medical marijuana.
2 years after the Montana legislature passed a bill to overhaul the state's medical marijuana laws, Democratic Senator Tom Jacobson of Great Falls says more changes are needed.
I mean, this is all brand new to Montana. We've not really done things to this extent in the past. We knew there would be some changes that would have to come about.
Jacobson is sponsoring Senate Bill 265. It would make a number of changes, including increasing the tax on medical marijuana providers from 2% to 4%. Jacobson says the Montana Department of Public Health and Human Services isn't receiving enough tax revenue to administer the medical marijuana program.
Rather than hamstringing the department in, not being able to further implement these rules, we wanted to make sure they had adequate funds to implement the statute.
But the biggest change, added as an amendment in the Senate, would be untethering patients from providers. Currently, patients who do not grow their own marijuana must choose a single provider they will buy marijuana from.
Being tied to one provider, though it creates some ease in monitoring, it creates difficulties on the patient's part when they need to get their medical marijuana.
Jacobson says removing that restriction would help patients who need medicine but can't get to their approved provider. SB 265 would instead limit each patient to buying 5 ounces of marijuana a month. Their purchases would be tracked using their medical marijuana card.
You scan your card, it says, oh, you've purchased your allotment, for the month, or you've already gotten it from this place, so you can't get multiple.
DPHHS leaders say they're already working to determine what steps they would need to take to implement untethering by July 2020 if the bill passes. In Helena, Jonathan Ambarian, MTN News.
Thanks, Jonathan. Earlier, Senate Bill 265 passed the Senate on a 36-14 vote.
Next up, it'll be heard tomorrow morning before the House Taxation Committee.